Hey, what's going on, everyone? I want to attempt to be a little bit vulnerable at the moment, and also want to give a shout out to um, a few people in the community that have been checking on me for the last few months. I first mentioned this back in May, I believe it was, and both Darium and Makeup Fetish have been following up with me, sending me messages, checking on the status to see how things were going. And I just want to say I really appreciate both of you for checking in on me and caring about this situation. I'm going to be a little bit transparent because I want other men, especially black men, to be aware of this so they can take action before things get to this particular level. I grew up in Southern California, but I lived in Portland, Oregon for 22 years, and I moved to Vegas 5 years ago. And in that transition, I changed, of course, I changed coverages, and I changed my PCP. And the medical system here at least in Las Vegas, I don't know about all of Nevada, but at least in Las Vegas, it's kind of disjointed. It's not what I'm used to, where everything is housed within a particular medical facility. Your doctor works for the hospital. When your doctor sends you for lab work, you go down to the second floor. Your doctor sends you for MRI or X-ray, you go up to the 5th floor. All your care is within my chart, so the doctors that you're seeing are all talking to each other. The notes are all there. Moving to Vegas was a very different experience for me. I've gone through 4 primaries in the last 5 years. I'm on my 4th primary here, trying to find a better fit, and that's more close to what I had growing up in California and what I had living in Oregon. I specifically sought out a younger doctor. I sought out a woman doctor because they tend to be more sympathetic and empathetic to the needs of their patients. And I specifically sought out a black doctor because I wanted someone that's more in tune with the needs of me as a black man and the care outcomes that that go into making us healthy. And it paid off because none of the doctors that I've ever been to have talked to me about prostate cancer, and it's also not something that's talked about within amongst males, at least in the black community. It wasn't a topic of discussion within my family. Growing up, it's not a topic of discussion amongst my friends group, and you really only hear about it when someone that's old dies from prostate cancer, so you figure that it's an old disease. But I went to go see my new primary that I started with this year, and I was seeing her for follow-up care for my GLP-1 medication, and so she ordered some blood work, and she said, I with your age, I think it's best for you to get a prostate check. So she threw in a blood work request for a PSA test. So that test came back elevated, so that my PSA levels were at 7.4, and you want to be below 4 for that particular measurement. And my percent of PSA free was 7%. So anything less than 10% is cause for alarm. Unfortunately, though, she wanted to do a follow-up within in 6 months to see where my levels had changed, but I didn't want to wait around 6 months for that, so I referred myself, and thankfully my insurance allows me to self-refer. So I referred myself to a urologist, and I met with that urologist in July, beginning of July, and she ordered a new blood test and an MRI scan. So this blood test was to check for, it's called ISO-PSA, and my ISO-PSA index came back at 26.2, and anything greater than 6 is cause for alarm. And the MRI I did was done with contrast, and it showed the possible existence of a tumor or tumors on my prostate, and gave me what's called a PIRAD score of 4. So that shows that there's a high likelihood of high-grade cancer being present on the prostate. So, of course, the only way to officially diagnose prostate cancer is to do a biopsy. So I did a biopsy on September 13th. And what they do is they take 12 samples using needles across the prostate area, and to see any evidence of cancer within those specific areas. And the 12 samples, 10 of mine came back as malignant, because so many, more than half of the samples came back as positive. There is cause for me to receive treatment. So that treatment is either having the prostate completely removed, or going through 9 weeks of radiation treatment to eradicate the cancer cells. And along with that would be some kind of hormone therapy to lower the testosterone level in order to adequately treat the cancer cells with the radiation. And of course, there's risk for both treatments. I think the removal is the more risky proposition. So I don't know about that. But I have follow-up appointments, one with the surgeon and one with the oncologist, to discuss both forms of treatment, and we'll go from there. But I have to do a full body scan to make sure that there is no cancer outside of the prostate. And the reason why I'm putting this out there is to hopefully prompt more men to openly discuss prostate cancer, and for people to go out and get checked. You don't have to do a digital rectal exam any longer. This could be done with a blood test. And I want to speak specifically to Black men, because we are at a greater risk of not only getting prostate cancer, we are 70% more likely than white men to get prostate cancer. And we are also twice as likely to die from it. So if you're a Black male, you want to start getting your PSA test, that's the blood test. You want to start getting that test at the age of 45. Generally for other races, that starts at the age of 50. But for us, it needs to start at the age of 45. Also, if you're considering starting a GLP-1 journey, or if you're on a journey, not only being Black is a higher risk, but being diagnosed with metabolic syndrome is also a risk. And in order to have metabolic syndrome, you have to have 3 of 5 conditions, and I had all 5 of them. And what that is one of the conditions is having excess abdominal fat. So if you have a waist circumference that is, for a male, if your waist circumference is 40 inches or larger, that is one. If your triglyceride levels are greater than 150, that's another. I had both of those. If your HDL levels are low, mine were, so that's 3. Elevated fasting blood sugar levels is another, that's 4. And having high blood pressure, so that means that your systolic measurement is 130 or higher, and your diastolic level is 85 or higher. So I had that. So not only does that make you more, put you more at risk at getting prostate cancer, but it reportedly makes the treatment of it more complicated. So that's another reason to look at starting this journey in order to mitigate that risk. And that's where I'm at. I just want to put that out there. So hopefully it will prompt someone else to start getting tested to make sure that they get ahead of this. Don't wait to the age of 49 like I did. Start talking to your doctor about it. Whether you're black, white, Latino, or any other race, at a minimum, you start getting tested at 50. But if you have a family history of it, or if you're African American, you want to start getting those tests at the age of 45. But please talk to your doctor. So as far as me, I'm fine. I've been mulling on this all day. I went over the pathology report with the doctor this morning, and I was kind of expecting this. So this is just confirmation. So I've been mulling through it throughout the day. Had some conversation with my family to just let them know what was going on. And but like anything else in life, I'm just going to attack it and get through it like anything else. So that's where I'm at. So thank you very much, and talk to you later.